He is going to talk on behalf of Minister for Health. Yes. Ms. Rosie Akbar.
Thank you. I'd like to probably start from the bottom. Plans for preventative healthcare. I think, as you know, that we have a Assistant Minister for Health who is also focused in this area, also doing the primary healthcare issues, going out to the maritime areas, the rural areas, focusing on the NCD area. And I think that's, we have, of course, there's restricted plans in that respect. So I don't know what exactly they meant, plans for preventative healthcare. There is actually a plan. And I think a lot of it is to do with the value systems and how we view life. And of course, diabetes is extremely high in Fiji. Nearly every day, I don't have the statistics offhand, every day somebody's, some part of the body is amputated, in particular the foot or a knee above. It's very, very common. In fact, I was just told yesterday one of our previously well-known rugby players has just had an amputation. A lot of it is to do with lifestyle, of course. We also have, put the health levy on, in particular in carbonated drinks, which is very, very common, intake of sugar. So we are very much focused on that. As you know, that there's been a lot of publicity regarding NCDs. Of course, a lot of it is to do with the lifestyle in respect of, cardiovascular diseases, cardiovascular problems. We have a lot of young people also, suffering from what they call, cardiac events, and I think we need to be very mindful of that. Regarding emergency services ambulances, yes, there has been talk about that. As you know, a few years ago, government also have the National Fire Authority now that delivers ambulance services. This is a system that is adopted in many other countries where emergency services are actually, assimilated. So you have the fire, you have the ambulance services. We also have, of course, there are three types of ambulance services. One is, of course, through NFA. The other one, of course, is by St. John's Ambulance. You also then have some ambulances that are actually assigned to the actual hospitals themselves. They may be that's the three key ones. It does not mean there's no opportunity for private sector health ambulance services. In some countries there are, where people do offer. And again, I wanted to talk later on in the question and answer session about how there's so much economic potential for the private sector to participate in some of these service areas in Fiji. They've traditionally shied away from, or they actually have been prevented from doing so. Please, you need to think of that as entrepreneurs. In the same way, as I said a few years ago, actually NANDI, the NANDI Chamber of Commerce, when it had organized one of the functions, many business people in Fiji today who are carrying on businesses weren't engaged in that business 30, 40 years ago. Your likes of your Moti Bhais, your Tapus and your Punjas and what have you. A lot of these people started off as small traders in cane farming areas. They were selling groceries essentially. Today they are dealing in motor vehicles, they are dealing in duty-free goods, they are dealing in food products, they are sole agents for all sorts of things. So they've actually expanded their business. So in the same way we are saying there's another new frontier that's coming up also. The Minister for Agriculture talks about agriculture. We now have actually agricultural leases being given up to 99 years. The Minister for Lands just gave out some leases recently for agricultural purposes for 99 years. Itauke Lands Board just recently gave out some agricultural leases for 99 years. A 99-year lease is as good as a collateral as a 99-year lease for tourism purposes, or for industrial or residential or commercial purposes. So again, there's, you need to view these businesses as enterprises where you can actually make some money, but also at the same time contribute to the economy. So I think ambulance service is one of them. In the same way we are now talking about, a few years ago, decades ago in Fiji, you would not actually talk about private hospitals. Hospital system was seen as public health hospitals. Today we're talking about private health systems. So in the same way we should be viewing agriculture, in the same way we can view ambulance services too. And that, of course, creates that level of competition and that level of service delivery. I'm sure many of you would probably, like to have a nice ambulance if you think it's not available. I mean, sometimes it's just a question of a paint job but some people like paintings also, but it does create that level of, I suppose, appreciation and expectation. Updated medical profession. Yes, this recruitment has been going on. As you know, we had a team, the Honourable Minister for Health, the PS for Civil Service, the PS for Health, were recently in India, together with a team of other doctors to interview some specialists. These advertisements have not only been restricted to India, but also to Australia and New Zealand. They've also advertised on LinkedIn. We're getting applications coming forward. Some have been selected. There are other areas in which we still lack people who have applied. Some have applied, but the quality of the applications may not necessarily have been good. So as government has allocated quite a bit of funding for this area. Specialists in Fiji, for example, of course, Fijian specialists, we lack Fijian specialists because there has been no investment. As I said to the high school and university students, it takes about 10-15 years to actually turn out a good specialist. The doctor will tell you that you don't get somebody doing the MBBS and then you expect them to cut you open and play around with your heart. They need to be around for 10-15 years, need the level of exposure, need to be sent overseas. We've just had Dr. Biribo, who is a local, who was sent away to New Zealand. He is now carrying out neurological surgeries, neurological-based surgeries. These surgeries were never done in Fiji before. They are now being performed in Fiji. And I can tell you, yes, there are some aspects in respect to the infrastructure that needs upgrading. I completely agree with that. A lot of it sometimes may be issue of irregular maintenance, irregular painting, irregular maintenance of equipment. But there are certain aspects that have also improved significantly. Recently, I don't know how many have actually been, but if you really are interested in that area, and we can organize that for you through the Ministry of Health, go down and see the operating theatres at CWM. You would actually think you're sitting in somewhere Australia, New Zealand, or USA. It is phenomenal. It's quite amazing. So there are certain aspects that are being developed. There is also, as you see in the budget, an allocation for an upgrade of CWM, in particular the maternity ward. There are other areas that are also being developed. As I said, that Lautoka and Ba hospitals are currently being looked at through a PPP arrangement. But we are also building, other facilities in Kayasi and various other places to be able, to ensure that less pressure put on centralized, divisional or subdivisional hospitals. The other thing that the Honourable Minister also has done is that we've had a locum now provision where in peak periods, doctors from the private sector are now coming and serving the public hospitals. So in Suva, Nosori, Nandi, you have doctors from the private sector are coming in, say, between, I think, 6:30 a.m. till about 9:30 a.m. Because a lot of people who do go to work may go to, say, Nandi hospital, they may be feeling a bit feverish, and they go to the hospital to, see the doctor, and then they go off to work. So there's a lot of people at that peak period time. So then the private doctors are being used to reduce the waiting period. I have to also say there is, it's really quite interesting. I was at a forum, we were talking about social media. And unfortunately, I think social media, as I said a few days ago, in some respects has been really abused in Fiji. You have people, for example, commenting on various aspects of operations without having any appreciation of the context of them. I have personally been sitting next to Minister Akbar when people have phoned her up, and literally this is how they talk to her. Hey, Rosie, I've been waiting here for 20 minutes. No doctor has seen me. In Australia, the waiting time at an outpatient is about 2 hours and 15 minutes in New South Wales. In Queensland, if you go to even an emergency, they'll say it's not an emergency, you go and see your GP. So I'm not trying to justify delays per se. What I'm saying is that people need to understand that the public health system in Fiji actually in certain respects is working well. There are certain aspects, of course, we need to improve. There's no doubt. I think everybody agrees with that. This is why we've actually, for example, gave doctors up to about an 80% pay rise to be able to ensure that these doctors actually stay interested in the public health system. You cannot improve public health system with doctors overnight. Doctors take time. There's a 5-year, 6-year period of study. Once they qualify, then of course they're starting from scratch. So that's one aspect. So we're addressing a legacy issue. The other issue, of course, in the specialist areas, how many qualified radiologists do we have? Pathologists do we have? Fijians I'm talking about. You know, in the school consultations we had, a lot of the students are at Suva Grammar School. There's something like 250 students representing about 25 different schools. And they complained about the fact that, there is not enough student counselors in schools, you know, to deal with issues like teenage pregnancies, to deal with drugs, to talk about career paths and what have you. And they said, you know, it's not good, you need professional counselors. Completely agreed. I said, yes. Unfortunately, some of the teachers are actually doubling up as counselors. And we actually have scholarships in the toppers area for people to go and study and do a degree in that. And then I asked them the question, I said, how many of you want to become a counselor? Pursue a study in degree? Nobody. You see, because what are we teaching our children in terms of career paths? How many of you actually go and say to your children, I really want you to become a counselor? You probably go and tell them, I really want you to become an engineer or a doctor or a lawyer. How many of you actually go and say to them, I want you to become a marine scientist? If you know interest in science. So the value systems too. We need to look at that too. Delivery of services, attitude of service. Yes, there is an issue. We've set up 157. Please call 157. If you go to a hospital, a doctor talks to you in an ill-mannered manner, a nurse does that, the security guard does that, you have the right to call 157 and lodge a complaint immediately. Various protocols have been set up. We actually expended in $250,000 to have this 24-hour service. And we will be expanding that service line to 2 other key ministries, and we'll be then doing that to entire government services. The next 2 ministries we are looking at is Ministry of Poverty Alleviation and Ministry of Employment, where the Permanent Secretary of Civil Service is working with the 2 respective permanent secretaries to have that. So 157 you can call. Recently I received some statistics about a week ago that 93% of the callers had the issues resolved. So I think, a lot of these issues need to be dealt in that manner, at an operational level. It's not a political level. It's not a political issue. It's an operational issue. So when you go to the hospital and there is not enough beds, it's not the minister's job per se at that operational level. It's the MOD, or the medical divisional person who is in charge of the hospital, or the permanent secretary's responsibility to make sure that these things are actually at an operational level is functioning well. Of course, yes, it becomes a political issue if the government does not give enough money. I can tell you one more point. There is so much pilfering that takes place in hospitals. We have put out new sheets, new cutlery. Within 2 weeks, the towels are gone, the sheets are gone, the cutlery is gone. So whether it's the nurses, whether it's the patients, whether it's the visitors who are walking home with it, it's a big issue. Somebody is nicking this stuff. Now, we're not going to put a chip on these towels or these cutlery or whatever. Somebody said, how are you going to fix it up? But it is a big problem. Pilfering is a big problem. I have driven past many people's homes that says on the towel CWM. Olotoga Hospital is a fact. Some of them are people who work in these hospitals. So you see, then somebody comes along and says, the government is not providing enough stuff. My auntie went and she was told to bring her spoon and fork. But it is a fact, ladies and gentlemen. So it's a national issue. We need to deal with this issue in terms of value systems we have. The cleaner hospitals, yes, we're working on that. In fact, a lot of these issues have been done because of, I'll give you a very simple example. I was recently at, my wife gave birth at CWM, and the bathroom. Now this bathroom, normally you've had people who've built hospitals in the past with no experience in building hospitals. You cannot get a normal architect with no hospital experience to put up the hospital. You cannot get a person who does the services infrastructure who is building a market to come and design a hospital. So in the hospital, in the bathroom, the bench that's there is built out of wood, a normal wood. So what do you think is going to happen? The wood will rot. The wood will rot and pieces will fall out and it'll look dirty and it's black and what have you. So you see, these are very basic things. You need to have a steel bench. All those types of, issue specialization has not been built in to the infrastructure. So for example, the hospital is being built in Ba. The architect is somebody who's built a couple of very well-known hospitals in New Zealand. So we've hired the services. Yes, it costs a bit more, but the product, the finished good will be better. And he or that company is working with a local firm. So that's the kind of tie-up we need to do to be able to ensure. I mean, you don't, for example, take a normal tile that you would put in the house and put it in a hospital. That's what's been done in the past. So the tiles, when the hospital bed comes along, obviously make a mark. And you can't take off the mark, so the place looks dirty. So in order for us to make a permanent, clean environment, you have to rip it all out. So these are some of the issues. But of course, I'm not denying that the day-to-day cleaning cannot be improved. Of course, it can be improved. We've had in the past when, for example, outsourcing was done. Unfortunately, in the past, when outsourcing was done, it was given to the cleaners who used to work there before. They formed a cooperative, but the quality of service is not improved. So some of those cooperative companies are still using rags. So we have to get rid of their contracts. We have to get more professional people come in. We need to give them a 3 or 5 year contract so they will actually invest in machinery that will actually provide the quality of services that you want. So those are the kind of things that we're trying to unlock and look at. Thank you.
Ladies and gentlemen, I think all the ministers have responded very well to all the areas that we put up, and I think there is a